We have put together our top 5 most asked questions about prenatal chiropractic care, and we're going to go through all those today, and I'm going to answer all your questions that you have. So the first question that we get in our office is, how soon after I find out that I am pregnant can I come in for care? The answer to that is, we hope you are already in care before you are pregnant, getting just either infertility work or just chiropractic care in general. But as soon as you find out you're pregnant, you are welcome to come in. We always say the sooner we get you in your pregnancy, the better, because we can prevent any issues such as pain, discomfort, sciatica, or we can get on top of them as soon as possible if you do have any of these issues come up. But when you see us really late in your pregnancy, we just don't have as much time to get things under control or prevent things as we do early in your pregnancy. So question number 2 is, how long can I receive care while I'm pregnant? And the answer is literally until you are in labor. So we've had mamas come in, they are in the midst of prodromal labor, which is just labor over a few days. So they are getting adjusted every day during that long phase of labor. We're also seeing mamas coming in, the day that they go into labor, they're getting adjusted, or a few hours before they go into labor. So it is totally fine to be adjusted all the way through your entire pregnancy, especially in those early few phases of labor. As long as your water hasn't broke and you're just having a lot of contractions, we will be happy to see you. Okay, so number 3, is it safe for me to be adjusted while I'm pregnant? And is it safe for my baby to be adjusted while I'm pregnant? So the answer to both of those is, of course, yes. So you want to make sure you are seeing someone who's certified in prenatal chiropractic care, because there are some precautions that we take while you're pregnant. We have these amazing tables that the belly piece drops out, so your belly actually is supported when you're laying on your stomach. We also have a bunch of pregnancy pillows for all phases of pregnancy that will support you. Remember, baby is an amniotic fluid, so baby is safe, baby's floating, even though you're laying on your stomach for a brief period of time during our treatment. Baby's safe. It is 100% safe for you to be adjusted as long as you're not having any issues such as bleeding or things that you need to be on bed rest. Perfectly safe to be adjusted. It's absolutely wonderful for you. It's wonderful for baby. Your baby actually feeds off your nervous system when you're pregnant. So if you are super stressed, you have a lot of tension, you have a lot of pain, your baby also feels that. So we want to make sure that your nervous system is functioning optimally and that you are not stressed so that baby is not stressed. Okay, so number 4. People call in and say, my baby is not in the right position, my baby is transverse, my baby is breech, can you help me? And the answer is yes, that is what I do. I am a certified Webster provider, which actually is a specific technique that actually helps for optimal baby positioning. So obviously as chiropractors, we are not turning the baby itself. We are working on balance. So we use 2 techniques. I use the Webster technique, and I also use Spinning Babies protocol, which will help get baby in optimal position. Now, ideally, we are doing this around that 25th week of pregnancy, regardless of position, because we want baby to stay and get head down and prepare for birth. But if we know we have a breech or a transverse baby, we are treating you more aggressively to get baby in better position. And usually what we find is that there's not a lot of room for baby if they are not in the right position. Either that uterus is twisted or we have some pelvic alignment issues. And there's a specific ligament that goes from the sacrum to the uterus, and so that's your uterosacral ligament. If that is twisted or if there's tension there, the uterus cannot get in optimal position, and we do find a little bit of twisting, and usually that's when we find baby is in a different position. So if we can balance and align the pelvis, hips, low back, round ligaments, then baby gets in optimal position, we are head down, and we are ready for birth. Okay, the last final question that we always get is, if I start chiropractic care, will it help my labor? And the answer is resounding yes. A lot of our moms under prenatal care have amazing labors, and they are quick and they are fast and they are pretty painless, and they just have great outcomes. So we just encourage you to get under care at any point in your pregnancy. You can follow us on Facebook or Instagram, or give our office a call, and we will give you more information on our whole treatment plan.